Spreading alongside the coronavirus is another danger in our country and around the world: racism. The virus has largely affected people of color, with Black Americans accounting for 33% of COVID hospitalizations. Joining me to talk about those realities is Chairman of the USCCB ad hoc Committee Against Racism, Bishop Shelton Fabre of the Diocese of Houma-Thibodaux in Louisiana. And Bishop, earlier this month, you and other members of the U.S. Conference of Catholic Bishops released a statement expressing concern about incidents of racism in the midst of this pandemic, particularly bullying. Talk to us about what concerns you.
Yes. Many Asian Americans are being harassed and bullied, particularly those in the medical field and those who work in other fields with regard to the coronavirus. And mistakenly, the reason for the virus is placed on them, and because of people's mentality in that regard, they are bullying and harassing members of the Asian American community, which is unfortunate because that's not acceptable as they attempt to help others to heal, and together with all of us try to respond to this virus. To be harassed and bullied out of xenophobia and racism is just not acceptable. So we expressed our concern about that.
Wow. Another unfortunate reality revealed by the virus is how healthcare outcomes can too often be determined by race. Data from MedPage Today shows in your home state of Louisiana, African Americans made up 70% of deaths from the virus, while they only account for 33% of the population. What accounts for that, and what can be done about it?
Yes, we also issued a statement, encouraging civil officials to examine that. There are so many reasons. I'm no sociologist, but the CDC has mentioned reasons that African Americans in particular and people of color may be affected more. One reason is because they tend to have multi-generational households, and they cannot isolate, they cannot self-isolate. Another reason is many of them do not have health insurance, so they cannot seek assistance with their health care when they first get sick. Many of them don't have paid leave, so they have to continue to go to work, and they cannot do what they need to do to help them to heal. And also just the residuals of racism that have brought about all of the comorbids in the lives of people of color that in so many ways systemic racism has visited upon them. Many African Americans do not live in neighborhoods that have grocery stores, so they can't get food that is more healthy food for them to eat. One of those tiny little things that I think is playing out with regard to this pandemic. So we express great concern about that and ask that be examined and looked into and responded to.
Right. All right, last thing, you're currently in phase 1 of reopening in Louisiana. What does that mean for churches? Are you holding indoor services, and what precautions are being taken?
We are following and adhering to what the civil officials ask of us. We can have 25% of our occupancy in our churches with social distancing. We are wearing masks. We are requiring hand sanitizer. We are sanitizing the church after each service. We're doing everything. We are encouraging people who are sick or who are elderly or immunocompromised not to come to Mass right now. The dispensation for Mass remains in place. We're also having Masses outside. We're continuing. It's going to be too hot here very soon to do Masses outside, but we're doing everything that is being recommended to have Mass inside, and thus far we've done really well. I'm very proud of the priests, and I'm very proud of the faithful in the diocese who have responded.
All right, I'm sure everyone's happy to have those churches open. Bishop Shelton
Absolutely.
Fabre, who heads up the USCCB's Committee Against Racism, thanks for being here.
Thank you very much.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.